Good evening, everyone. A very warm welcome to all our audiences tuning in. Thank you very much for taking your time off to join us for our BMAX monthly webinar series. If you're already following us on our social media platform, you would already know for the month of November, we are focusing on healthcare simulation. So, in relevance to our theme, as a nurse, always expect the unexpected. We are giving the spotlight to our fellow nurses, honoring them for their continuous and relentless contributions to our medical industry. So let me introduce myself and the company I represent. I'm Manusha, Product Executive for Healthcare Simulation, and I'm from BMAC. We are a medical and engineering consultancy organization, part of Baustat Singapore Group. Our mission is to provide technologies to enable our clients to either educate, treat, or care. We collectively believe that each individual has the potential to stretch further, and our role is to identify those gaps and provide the right kind of solutions and tools for you to live life to the fullest in healthcare and sports. And if you ask me why BMAC, well, we have over 3 decades of credibility in the market and well known for our strong global recognition, having presence in Singapore, Malaysia, Thailand, China, and Hong Kong. So, for today's webinar, we will have our guest speaker, who is a nurse himself, to share his experiences and thoughts on nursing and importance of medical simulation for healthcare professionals. So it'll be more of an interactive session on facts and experiences. We will also be sharing on our solution offering in medical simulation as well. Then there will be a Q&A session later on. So we encourage participants to join in and ask us on the comment section. And for that, you will have to log in to your YouTube account to send in your questions through comments. So any further inquiries or pricing related questions, please scan the QR code here to fill up the inquiry form and we will get back to you. So without further ado, let me invite our guest speaker for the day. He is BMAC Malaysia's very own country manager, having almost 20 years of experience as a nurse with expertise mainly on post-basic, emergency, and wound care. He is also a part-time lecturer at OUM. So welcome, Jensen.
Hi, Manusha. Thank you so much for inviting me.
Sure. How are you feeling today?
It was great, I was waiting for people to invite me, to talk about nursing. So now I am.
All right. Okay. So let's just dive right in. Coming back to our theme, why as a nurse we have to always expect the unexpected. Well, we know the daily routines of nurses are rarely the same twice. Working in the front line of patient care means they are always interacting with people who are in stressful situations. They also have to react appropriately to emergencies and unexpected events. So, good problem solving skills and quick thinking are both ideal qualities for nurses. Actually, a friend of mine who is a nurse, she told me one time she's been handed a finger over ice in a cup. And such thing happens, right? So on these circumstances, it can be terrifying if you're not ready or prepared to face them. There's no set pattern or criteria, especially for the ER. Anything is possible. And since you've been an emergency nurse in the past, when you were a practitioner, what is your take on nursing qualities and any personal experience of such situation?
Manusha, very good one. I think your friend received a finger, I received a whole arm, the whole forearm in a bag of plastic and a full of ice. So that was terrifying, But, at least that was like what you said, expect for the unexpected, So, but the thing is that, nursing team is the one team that work round the clock, and many times the nurses will be the first responder or the person to detect the deterioration of a patient condition. Hence, as a nurse who is on duty, we will have to expect for the unexpected. Let me share with you one occasion when I was, working, as a locum from the ER to the ICU. I was very reluctant that day. I was very tired, but the matron just came to me, hey Jensen, do me a favor, let's move you to ICU. It's all full. I said, okay lah, I'll just give in. So I was given the easiest patient to care for. So the patient was admitted due to heart attack, or we call it AMI, the acute myocardial infarction. We show that there's ECG changes and also elevated cardiac marker. So the doctor had actually prescribed for a thrombolytic. So what is a thrombolytic? Thrombolytic is actually a drug to dissolve blood clot quickly. So he was actually prescribed on a drug called streptokinase. All right. So after administering the drugs on IV infusion, I served him dinner because it's dinner time. So while I turned my back and started to walk out from the room, I heard something drop on the floor. Then I realized that, patient dropped something. So, I when I turned my back over, and I realized that he dropped his spoon. But to what my shocking was that he suffered from a CVA, or what we call it a cerebral vascular accident, or in layman term we call it a stroke. I was panicked at that time because I would need to act very fast within the golden hours. So that's why, again, I would like to emphasize, as a nurse who's on duty, we always expect for the unexpected.
Okay, so what did you do with the patient? Actually, I'm curious to know.
So, we did whatever had been prescribed by the doctor, but within the stipulated golden hours. But looking back right now, where I'm sitting right now, when I look back, I hope that, or I wish, I was trained to handle such cases to cut down on the lead time and also to make sure that the patient is safe. But however, the patient is safe. It's just that, maybe because I was a bit inexperienced, because most of the time I'm working in ER. So when you put me in ICU, I was a bit handicapped. So due to, certain procedures and things like this. So if I were to prepare myself earlier, with ideas how to handle it properly, it would just cut down more lead time.
Mm-mm.
Mm,
Actually, you said that you brought up something about patient safety. So
correct.
I think patient safety itself, it has been a huge topic for a very long time. You know, while trying to interrelate healthcare simulation and patient safety. So, what is medical simulation? It is basically a technique referred to activities that mimic the reality of a clinical environment to promote decision making and critical thinking skills. So, from an educational perspective, it provides the opportunity for learning that is both immersive and hands on, right? So, in order to improve education and ultimately enhance patient safety, healthcare professionals are actually using many forms of simulators, including virtual patients, and we also have interactive mannequins such as a patient communication simulator. So all these various forms of medical simulators, they are available to potentially recreate scenarios, specifically the ones that are rarely experienced, and tests professionals in challenging situations. So, what are your experiences with simulation, and how do you think it impacts patient safety?
I would say that, nurse and simulation, they're bread and butter somehow, It is mandatory, for nurses to be trained using simulation as part of their training and assessment. All right. Like, for example, I'll give you some of the example. Like, when diploma students, or we call it the undergraduate nurses, they will have to perform one thing called OSCE. So what is OSCE? OSCE, if it's a full term, it is called the Objective Structured Clinical Examination. So which the nurse will be assessed based on the skill set. All right. And in OSCE, we will use different types of simulation too, ranging from task trainer to standard patient. So what is standard patient? Like, maybe we'll ask our senior or juniors to come in to become like a role model, inside a role play, I would say that. And for postgraduate, whereby we will expose to more sophisticated simulation tool already, ranging from virtual patient to high fidelity simulator to solve real world problems safely and also efficiently. On top of that, for every nursing school, it is a must, to have a skill lab, because it's a mandatory requirement from the Ministry of Higher Education as part of the practical training for nurses curriculum. All right. So before you go through it, you need to submit. They will have to come and look at the so-called the simulation lab or the skill lab. Before they approve that nursing program.
Mm-mm. All right, so OSCE is basically a form of evaluation method during a nursing graduate program, right?
Yeah.
So, what about ongoing evaluation of nursing competency? Come to think of it, it isn't exactly practical to think that graduates of nursing education programs have received all the training they need, when they depart the doors of academia. So, this is where continued medical education for nurses becomes an essential tool to help practitioners improve their knowledge, skills, and expertise so that quality patient care is provided while errors are minimized. So actually, reports have shown, ongoing evaluation of nursing competence with appropriate medical simulation training is actually necessary it's a necessity to ensure patient safety. So what is your opinion on this?
Again, I tell you, every nurse is a scholar. Every nurse is a scholar. We need to go through every test that have been given to us. Okay. One more thing is that for your information, nurses will have to renew their BLS or basic
Mm.
life support, or ACLS, we call it the acute cardiac life support, or ALS lah, in short, every 2 years. It is to ensure that their skill set is actually up to expectation according to the latest guideline to promote patient safety. All right. And in BLS, basic life support, they will use task trainer like CPR torso for practice. And when you go up to ACLS, which is at the advanced cardiac life support, they will use moderate fidelity simulator, all right, to simulate moulages, And in certain wards like ER, like ED or casualty, we will have to go for ATLS. So ATLS is actually acute trauma life support, all right. So in one scenario which we are simulating, I remember that there's one scenario that we are simulating, a high risk accident with the help of firefighting department involving two vehicles, and it was followed by an explosion. So the car got exploded. And then in this scenario, we are tasked to involve standardized patient, with some of my classmates, will pretend to be the patient. So again, in this assignment, we are supposed to rescue all the 10 casualties, all the 10 patients, which are all my classmates, 10 casualties. And by the time when we settle down, right, we realized that we only managed to get 9 casualties. So we miss out one. So, we go search high and low, and then at the end we managed to found the last person. So he was, and then my last classmate was telling us that, because he was instructed by the trainer to hide himself in order to increase the intensity of the case, to match the realism, because in real life doesn't mean that there's 10 casualty, you just can just go in and easily just find 10, so that is to match the whatever that comes into real life solving lah. All right. And nowadays I realize that most of these simulation classes have incorporated high fidelity as part of their training, like vehicle extrication, like getting out a patient from a car during maybe a high risk accident, or maybe water rescue, a near drowned patient, a water rescue. So they are using this high fidelity simulation already, or the simulator, to mimic real life scenario.
Mm-mm. Yes, I agree. Actually, with current advancement in technologies, right, we use mannequins that resemble human beings of different height and weight for, like you mentioned, vehicle extrication and water rescue. So, as what you said, trainings are conducted regularly to meet guidelines and to make sure you're in par with the standards. So let's take this and move with the idea of conducting, this sort of training during the pandemic. And if there's something that the current pandemic has taught us is that the importance for in-service education of existing healthcare professionals. So I'm sure everyone's aware that during the peak of COVID-19 infection, hospitals experienced, a surge of infected patients. Nurses had has had also been cross-trained in new areas which they may have no prior work experience or training. So, for example, a nurse who previously worked in the post-surgical unit was actually thrust into an intensive care unit to treat patients with COVID-19 complication. And that nurse may not have proper training in maintaining a patient that is ventilated. So this basically informs us on the importance of having a comprehensive simulation training experience by exactly, reproducing or replicating the complications of a patient in a critical care setting. So how do you think, the pandemic has affected healthcare simulation training or medical education in general?
Hmm. To me, right, pandemic is a really tough time. Like, it's a very tough time. I would say that pandemic, has taken a toll on a lot of nurses. You know, Many nurses are advised to work overtime. I have nurses that come to me saying that they work more than 15 hours, 20 hours per day, because there's this manpower crush. Or even, transferred to unfamiliar wards like what you mentioned, due to lack of manpower resulting them, to be burnout. Working more than 20 hours per day, is a norm at that time. And moreover, many of us have seen the photos circulating online in FB, Instagram, showing that long terms of wearing N95 masks from our healthcare teams had made them to suffer, things like pressure injury over the ears and the cheek. But it's a mandatory thing for them to wear. This is protective gear. They need to wear it. Not talking about, the hazmat suit, they were sweating, it was very tough, but during the pandemic, there are also many limitations to simulation program due to government restriction on gathering, and also many nurses had suffered from burnout. So they do not want to participate in this kind of program. They would just rather go back, sleep, and or maybe if they just go back to meet up with their family and things like this. So as we all already knew, during the first few wave of pandemic, um, most of the patients are in elderly age group, which got a lot of premorbid, diseases, diabetic hypertension, cardiac, and things like this, and which mortality rate are very high as well at that time. So, many of the nurses are still learning the proper and also correct way to care for COVID patient, and also protecting at the same time, protecting how can they actually protect themselves from COVID. So all of these factors has impacted, to the nurses' overall well-being.
It's
Mm.
actually interesting that one part you brought up about elderly care specifically. Do you realize there are actually many simulator trainers in the market catering for adults, pediatrics, and neonatal, but very few on geriatric trainers? It's ironical because we are living among the aging population, and elderly care is extremely critical because of the functional difficulties that they experience. In fact, according to reports, it is expected that 25% of the world's population will be over the age of 60 by the year 2050. And by 2050, statistics have shown that in Malaysia, more than 15% of the population will be 65 years of age and above, whereas in Singapore, it'll be around 40% of the population, and in Thailand, it is expected to be around 30%. And that is, quite a widespread of an aging community in Asia. So a realistic trainer that simulates geriatrics' unique features such as their skin and frail characteristics can actually facilitate the awareness required by healthcare professionals. So, what are your thoughts on this?
Hmm. For geriatric, right? Geriatric has always been the talk of the town, lah. Has been always the talk on the topic, the so-called the hot topic, of the town, because we see that medical nowadays has helped a lot of people to ensure that longevity, to lengthen the lifespan all right? Hence resulting that, there will be a larger pool of silver population. So, however, anatomy and physiology changes due to aging has required them to change their lifestyle to fit into their current health condition as well. Like, for example, I'll give you a few examples. I'm actually splitting into two scenarios. One will be if it's an active elder that may go through sensory changes like presbyopia, vision blurring due to old age, cataract, loss of hearing, loose tooth, or loose teeth, which may require assistive tool to help them to correct their problems. However, for non-elderly patients, which are not very active, or bedridden, bed-bound, or wheelchair-bound, the caretaker or the family will have to, take concern of methods in how do they do the lifting and transferring, perineal care, and also the sign and symptom of pressure injury. So that is very important because that is very prone to happen for patients who are non-active, especially when they are either bed-bound or wheelchair-bound. All right. Still the saying, prevention is still better than cure. If you manage to actually to prevent it rather than you cure it. Yeah. And I remember clearly that, in one of the geriatric symposium which I attended, they let us wear this geriatric bodysuit to simulate old age. So that experience was an eye opener, to have that opportunity to be an elderly for 30 minutes. They let us to try it on for 30 minutes to simulate how are we going to get old one day, and then after that, so that kind of experience, I think that moment itself, it actually let me my synapses kind of link me up directly to my care in the past to the elderly, which is very different from any other population concerning on because we really have to take concern when we take care of the elderly is their skin turgor, their skin quality, their sensory responses, and also many more and since we know geriatric is a concern topic, I just wonder what kind of solution does BMAC have?
Yes, actually, we do offer a solution for geriatric training. Well, Nasco Healthcare is one of the few manufacturer companies from the US that is passionate about geriatric simulation techniques. They actually designed a mannequin called TERi, specially for elderly care training. And the trainer has been made precise with geriatric skin features and frail characteristics. She looks so real, that if you don't pack the mannequin in a case while transferring her around in your car and leave her in your front seat, people might just think you're going for a road trip with your grandma. TERi is also the EMS World 2021 award winning geriatric mannequin, so it has gained an international credibility. And this mannequin can be presented as both female and male with interchangeable genitals and wigs. So TERi offers an enhanced aesthetics of soft silicone skin that accurately represents an elderly person. And the simulator has pretty much all the conventional features of a nursing mannequin. So students can, practice basic skill techniques such as IV and IM injections, as well as urinary catheterization, while being weight distributed with fully articulating limbs. You can
Mm,
practice patient positioning and transferring, as it is an ideal skill, as you mentioned earlier, which is required within with an elderly patient. And learners can also train on daily living assistance, including denture removal and care. Hearing aid placement and optional wigs are offered for grooming purposes. She even comes with three interchangeable sets of pupils: normal, constricted, and dilated, to simulate different patient conditions. Students can also practice respiratory skills via manual ventilation with chest rise, tracheostomy care, airway intubation, and auscultation of heart and lung sounds. And with a built in CPR feedback technology, she can also be your advanced life support option. And as mentioned earlier, with interchangeable genitals, you can train skills across both genders, from pap smears and enema administration to prostate examination. All right. So now coming back to our discussion with Jensen, we've spoken about human mannequins in medical education, but there are different kind of simulation models which are set to enhance critical thinking skills. And medical simulation is basically, a process trying to resemble real life, but it is not real. Its realism depends on the fidelity of the simulator and the setting and the description of the scenario you choose to run. So it's usually classified as low, medium, or high fidelity. The higher the fidelity, the greater the sense of realism. So low fidelity simulators are usually used for training on specific skills like CPR skills that mainly uses task trainers. And in higher fidelity simulation, there is a stronger sense of involvement among healthcare professionals. And the setting of the scenarios are usually complex with holistic solutions for team training. And one of the essential components of simulation based education is actually debriefing, which is done after a training session. You know, Debriefing offers an opportunity for constructive feedback and self evaluation, mainly through video recordings of the training session. It is when the trainers and the trainees sit together and try to evaluate their actions and discuss on ways to improve. So, based on your experience, what is your take on these different simulation models and the way it actually impacts training quality?
Yeah, I think very interesting when you talk about all this realism, fidelity, and things like this. Because during a different stage of my nursing program, I was exposed to different types of mannequins. Okay, so just start off with diploma. So during my diploma, we used plenty of task trainers and low fidelity simulators. However, when I was doing my degree of nursing, I was exposed to different teaching methodology already. So, the teachers started to be more innovative. They started to use technological advancements such as learning with virtual patients, moulages using high fidelity simulators. All right. And I remember, my latest post basic, which in wound care 3 years ago, we started to use virtual software as a virtual patients and also VR, to help us to support the realism of the cases. All right. And I think students now are very fortunate, not like my time. Students now can just do their practical assessment just by a click away, from their browser. There's so many apps outside, virtual. I even use it as a part of my teaching in OUM, for the students to impart this kind of realism to them, so that when they go through it, they will able to actually to sense the realism, in each and every cases that they perform. However, as a trainer and also a learner, personally, I would still prefer a physical simulation training. All right. Why physical? Because during this, I find that the debriefing session, I got to receive feedback from the trainer, with the help of the recorded clips. And this feedback somehow, allowed the nurses to make their own reflection to improve, future performances. There's one scenario, there's one incident I can, which I would like to share with you all, will be in one of the debriefing session which I've performed, one of the simulation. I also went through the simulation myself, right? So there's one time, there's this during a debriefing session whereby I'm a participant myself. The trainer showed me on a recorded clip that my CPR compression that I was delivering wasn't the right pressure due to my bent elbow, you know. So during my bent elbow, so right after that, he taught me the correct technique. That and I really appreciate that, because of that piece of advice, has helped me to save many more lives, you know. And until today, I'm still very grateful on that piece of advice, So that's why I always prefer a physical simulation training together with a debriefing. All right. So Manisha, since we have spoken a lot of advanced simulation techniques, plus recording system for debriefing, how can BMAX solution help in simulation?
So When we speak about holistic simulation training models, our solution is simple. It's SkillCube. So SkillCube is a German product, and their mission focuses on comprehensive solutions for simulation and team training in preclinical and clinical patient care. And their product range includes simulated ECG monitors, ventilators, an instructor tablet, assessment tablet, CPR sensors, as well as audio and video recording and debriefing system, catering to a holistic training solutions. So, in relevance to their mission, they have actually developed their ECG monitors and ventilators on pre-existing models in the market to incorporate realism in simulation training. So SkillCube has a good engagement with the ECG manufacturers. For example, Zoll, Stryker, and Schiller ECG configuration is assimilated into their software technology. Well, on the other hand, you know, institutes can always opt for a generic user interface as well if you would prefer without any specific customized format. And the complete system utilizes cloud-based iOS models, which is iPad models, which doesn't require any maintenance. You will just have to update your software regularly for a free-flowing simulation training. And the hardware comes in a bag, and you have the iPads fitted into these bags that provides an actual look of a monitor and ventilator. And as for their AV recording system, SkillCube offers a portable version and a station setup version that has cameras mounted in the simulation area. Their recording system is efficient in a sense that they allow live annotation, which is live marking while the simulation session is running to indicate any errors made by learners on spot. So this feature basically enhances the debriefing session by encouraging learning and discussion based on accurate events, which will help students to identify their mistakes or how can they improve teamwork and technical skills. And as Jensen mentioned on how during a debriefing session the trainer had actually corrected his CPR technique by playing a recorded clip for he's actually able to assess his own method. So if you wonder now, how do we utilize all these devices and run a simulation scenario using SkillCube? Well, your institute or hospitals will be given a cloud account, in which you can upload your own scenarios, or if you choose not to, there is no issues. You can always use pre-programmed scenarios on the cloud that are based on AHA standards for ACLS and Pulse. These scenarios are seamlessly integrated into the controller tab. You'll just have to tap on your preferred scenario for a particular training session and run it. The instructor can always manipulate the vital signs in real time to assess your learner's competency in decision making skills. The system also offers a CPR feedback mechanism. So, when it is required, students can perform CPR and you will be able to gather their performance technique as the entire activity is logged by the system.
Like my
So, this,
case.
yeah, true. So, this is basically a summary of a high fidelity simulation training system. Well, I can always, explain a step-by-step instruction of using SkillCube, but it's certainly best to see in action. So we will play a video demo for you to give you an idea on how we can run a full-fledged simulation scenario featuring Nasco's TERi mannequin and SkillCube. So in this video presentation, let me just give you a quick preview of it. We will portray an elderly lady collapsing on the road, and this person will quickly be replaced by our TERi mannequin, and a passerby will try out a few CPR compression just before the paramedics arrive, and the medical team will connect SkillCube ECG monitor to the patient while an instructor will manipulate the vital signs and view students' CPR technique on the controller tab. So the patient will then be taken to the emergency department for further evaluation and will be connected to the SKILLQUBE ventilator model. Again, the instructor will be controlling the whole scenario on the tab, and if required, will send an emergency alert to the assessment model, which would usually be handled by the team leader. It's more like a pager to inform the medical team of an urgent situation. So this would be the content of it, and the video has been well designed and role played by our lovely BMAC Thailand team. So let's have a look at it. So that was the demo, and I hope that the video gave you a better clarity on the solutions we offer. So now we can attend to some questions, if there are any. Well, I see a few from Anand. Apart from TERi, do you offer other models of mannequins, such as for pediatrics? Yes, we do. We do. And he is also asked, I'm interested for a demo on TERi. How do I schedule for it? Okay, yes. We have a model, no issue. You just have to scan the inquiry form and give us your information. We will get back to you with a demo. And anything else? Right. This question I think is for Jetson.
So if patient have hypertension, GDM, I think is diabetes or renal problem, how prognosis them if have COVID infection? I think, Laila, I think, if bad prognosis or especially for age 30 and 60, that is very much depends on cases. I think that is for you must. I think each and every hospital has their own protocol in taking care of in taking care of COVID patient, whether is it private or government. So you will still have to go back to the protocol and guidelines. But usually, like what they said, why is it that vaccine has been distributed among our elderly or those who have um, pre-morbid diseases like hypertension, diabetes. I think because that they are the most vulnerable population. So if I were to logically link that, I would say that patients who are having pre-morbid usually they are more succumb to infection, especially to COVID. So, but of course, that doesn't is not a clean sweep statement. It will also depends on the patient's, each and every patient's, hemo pharmacodynamically, and also it works differently on the patient. So I would say that, yes, and also at the same time is no, because it's very individual. But at the same time, like what I said, having a pre-morbid, it give you a higher chances of getting infection than it is yes.
Okay, I
Mm.
think another question for Jensen. Had training with task trainers and simulators been helpful with a particular emergency scenario you encountered as a nurse?
Yuswan, thank you so much, for asking these questions. I find it very helpful, very, very helpful, during my time. Like what I said, because if you don't go through that kind of simulation, you do not have that confidence. Like I was actually from like, okay, if you were to follow me from the early on, right? I was an ER nurse and I was asked to work as a locum in ICU. What happens was that, my patient had a sudden CVA. All right, then I was it's something that I never encountered before. I don't encounter such a drastic, thought short time whereby the patient who is very healthy and suddenly, suffer from a stroke. So I do not know how to handle that. I do not know how to handle that. But that's why I wish that if my practice or there is a simulation that has given to me in such scenario that will enable me to actually to perform even better and also to shorten the length of time, because when a patient is having stroke, the most important thing we are talking about is the golden hours. The longer itself, the salvageable so-called percentage will start to drop. So back to your question, it is very important even for ER also. I find that when I perform certain simulation, I came back, I feel more confident. When the patient comes to ER, presented, different so-called signs or symptoms, I'll be able to actually to do it confidently, lah. Without, like just waiting for the doctor to prescribe or waiting for instruction. I'll be able to actually to stand on my own feet, to think, and then after that to know what to do. That is very important, I think. And also, eventually what we do is just that also simulation are always, when we are talking about simulation, there's always safety. It's always, safe for patient, and not only to me, it's not only for patient, it's also for ourselves. Yeah.
Okay, thank you, Jensen. So,
Mhm.
one more from Amy Theo. Is SkillCube compatible with different brands and models of patient mannequins? Yes, yes, because it's not specifically linked to any brand. In fact, using the SkillCube ECG monitor, you can use a standardized patient because all the shock given is virtual. Nothing is harmful, it's completely harmless. You can use your own people, or you can use a mannequin. You can use a high fidelity mannequin, or you can even use a basic mannequin with no electronics in it. So I think if you're interested in a demo, or you're interested to know more, just scan the QR code, fill in the inquiry form, and we will get back to you to give you more information on it, specifically like brochures or even a presentation, if you would like to know, how do we use this in different contexts. All right. So, any more question? And is there a way to get a demo? Yes, Amy. Yes, there is a way to get a demo. I just need your information. So send me your information through this inquiry form, and I'll get back to you with a demo. Thank you. All right. Thank you so much for your question. Is there any more?
Any more question, guys?
Any more before we end this session? All right. Okay. So I think thank you so much for everybody's participation, and thank you for tuning in. Yes, for those who've asked us specific information on demo, it's available on product information. Everything is available. So you just need to get back to us by filling in the inquiry form, and I will get back to you with all the relevant information required for the products featured here. So thank you so much. Thank you, Jensen, for being part of our webinar.
Thank you, Manisha. Thank
Thank
you,
you.
BMAC, and also, thank you for having me. I think it is a wonderful webinar whereby, we talk about simulation. I think because I think the trend is going towards simulation right now. So let's, go with the trend, and let's make sure that, everyone in this world is actually safe. All right.
Yes. All right.
Thank,
Okay. Dr. Pong is here. Thank you so much for
yes,
attending.
Dr. Pong, thank you so much.
All right. Thank you.
Thank
Thank
you.
you, everyone.
All right. Thanks. Bye bye.